Hello, everyone. My name is Nario Cantu, and thank you for tuning in for the Friendly Pharmacist podcast, starting now. Hi, everyone. Welcome to another episode of the Friendly Pharmacist podcast. I'm your host, Nario Cantu, and today we're diving into a critical and impactful topic, health equity and disparities in healthcare. This conversation is more than just a discussion. It's a call to action for all of us in the healthcare community to ensure that access and outcomes are equitable across all populations. Let's start with some context. Health equity is about ensuring everyone has a fair and just opportunity to achieve their best possible health. It's recognizing that not everyone starts at the same place and that we must address the barriers that keep people from accessing the care they need. These barriers are often rooted in what we call the social determinants of health, the conditions in which people are born, grow, work, and age. Now, social determinants of health might sound abstract, but they're very real and impactful. Think about things like economic stability. Can someone afford their medications or even a visit to the doctor? Education. Do they have the health literacy to understand their treatment plan? Neighborhood and environment. Is their community safe? And do they have access to healthy food or a nearby pharmacy? Healthcare access. Are there clinics nearby, or do they have to travel hours for basic care? Unfortunately, these factors often lead to stark disparities in healthcare access and outcomes among different populations. For example, minority groups, rural communities, and economically disadvantaged individuals often face systemic barriers to care. Here's where it gets personal for us as pharmacists. We're on the front lines of healthcare, and that puts us in a unique position to make a difference. Here's how. First, bridging the gap in access. Many pharmacies are the most accessible healthcare provider in their communities. For patients who live in rural areas or medically underserved urban neighborhoods, the local pharmacy may be their only point of care. We can extend services like telehealth consultations, affordable generic medications, and health screenings to ensure these populations get the care they need. Secondly, health literacy is a priority. A lot of patients struggle to understand their diagnoses or how to take their medications properly. It's up to us to simplify medical jargon, provide clear instructions, and even leverage technology like mobile apps or patient portals to guide them. Next, advocacy and collaboration. We must advocate for policies that address systemic issues like expanding Medicaid, improving public transportation for rural areas, or supporting federal programs that fund clinics and pharmacies in underserved areas. Collaboration is key. Partnering with schools, community centers, and even local churches can create health initiatives that reach those who need it most. Next, cultural competency. This is a big one. Understanding the cultural context of our patients helps build trust and makes care more effective. Simple steps like offering materials in multiple languages, training staff in cultural sensitivity, and respecting traditions can go a long way. Lastly, innovative solutions. Technology is our ally in reducing disparities. Telemedicine, remote patient monitoring, and apps that provide education and reminders can all help level the playing field. But we have to ensure that these tools are accessible to everyone, including those who may not have smartphones or reliable internet. Now, let's not shy away from acknowledging the systemic challenges that make achieving health equity so difficult. These aren't problems that will be solved overnight. But every step we take, no matter how small, contributes to a larger movement toward justice and fairness in healthcare. At the heart of all this is the simple truth. Everyone deserves the opportunity to live a healthy life. That's not just a healthcare principle. It's a human right. And as pharmacists, we're uniquely positioned to drive meaningful change, one patient, one prescription, and one conversation at a time. So I encourage you to reflect on your role in this journey. How can you and your pharmacy team make a tangible impact? Is it by providing education, advocating for policy changes, or perhaps partnering with local organizations to bring services to underserved areas? Let's commit to making health equity not just a goal, but a reality. Because at the end of the day, our purpose as healthcare professionals is to heal, empower, and uplift every single patient who walks through our doors, regardless of where they come from or what their circumstances may be. Thank you for tuning in to today's episode of the Friendly Pharmacist Podcast. I'm Nario Cantu, and I'll see you next time as we continue exploring how we can all contribute to a healthier, more equitable future. Stay safe, stay inspired, and as always, stay friendly